Hello all. Today's topic for discussion is on introduction to laser. Myself, Dr. Divyabharathi Selvam from the Department of Prosthodontics, SRM Dental College, Ramapuram. So first we'll get to know what is laser. L for light, A for amplification, S for stimulated, E for emission, and F for radiation. So light amplified by means of a principle called stimulated emission, and that's how the laser works as such. So this is the laser unit. We'll describe in detail. A laser, it is a device that will emit the light through a process of an optical illumination amplification based on the stimulated emission of electromagnetic radiation. So how does this normal as well as the laser light, it is going to get varied? Normal light, it is used for illumination and visibility, whereas laser light, it is specialized in enabling with precision in cutting, coagulation, sterilization, as well as stimulation in both the soft and hard tissues, and that is why it is being used in dentistry. So you need to remember with the three C's in terms of laser light. What are those three C's? The first C will be the coherent. So all the waves in the laser, it is going to be coherent in nature, in same direction. It will all travel in the same direction, enabling with the precise energy delivery. Next is collimated. The light will travel in a parallel beam so that there will be a minimal in the divergence. So it will specifically target to the tissues. Next is monochromatic. It is available in single unit color, single wavelength in order to have with a specific tissue interaction. So how does this laser, it is going to work? The physical concept of stimulated emission was proposed by Einstein in 1916, but it was only in the 1960s that the first working laser was developed by Mayman. So these are the three principles you need to know: absorption, spontaneous emission, and stimulated emission. So absorption, the child will take the energy. For an example, I'll give you with an example where the child with the chocolate. Okay. So the child takes the energy to get something they want, right? So a child, it is going to see a chocolate on a high shelf. They climb the chair to reach with it. So the energy from climbing is like you're absorbing energy. So an atom will absorb a photon and then an electron jumps to at the higher level. This is what is absorption. Whereas spontaneous, the child gives away the energy on their own without anyone asking. Example, the child, it eats the chocolate. It is happy and it will laugh and jump randomly. So an excited electron will fall back from that higher energy to a lower energy. And at that time, it will emit a photon. Not necessary, it has to be the same trigger. So this will be your spontaneous emission. Whereas in case of an stimulated emission, the child shares the energy because someone else triggered them. Okay, another child, it shows a chocolate and our child sees it. It will excite and give some of their chocolates to the others also. This is what is the stimulated emission. So in terms of in physics, an electron in an excited state, it will fall to a lower level because of the photon of the same energy is stimulated it. So it produces the another photon exactly with the same principle how that triggered photon it is going to be there. So in a quick thing, absorption, it will take the energy and goes up. There will be no interaction. Whereas in spontaneous, it will release the energy on their own from when they jump from the higher state to the lower state. Whereas in a stimulated, it will release the energy because something else has been triggered. So photon with the same exact energy as the energy difference between your excited and the lower state, it comes along. So the excited electron will drop to the lower energy and emit with a new photon with the same characteristics. So it is going to be with an incoming one with the same energy, same direction, and the same phase. This is what is the stimulated emission principle, and that's how your laser it is going to work. Okay. So now the key concept of this mechanism, we call it as the population inversion. So now look at the video. Just a minute. Okay. So this is how the population inversion it is going to work. Can you see there is a coil in which the laser medium it is there. It is can be made of a gas, solid or a liquid, and most we not use with an liquid form of lasers in dentistry. We'll either use a solid or with the gaseous forms of the lasers. Okay. So light, it is getting amplified by the principle of stimulated emission. That is a key thing I want you to understand. And you can see an excited atom that's moved between the two mirrors which are present in the laser unit. One will be an 100% or reflective mirror. Another one, it's a partial. The reason why it has to be partial on the other end, because the produced photons, it need to get energized out of the laser beam, right? So one will be a partial mirror, and there will be an electrical source present within it to simulate within excited the atoms to get excited, and that is a switch you can see in the image. So with that, the energy source will be get delivered into the lasing medium. The atoms will get energized, and that is going to continue with the process of an stimulated emission. So more photons will get energized and released, and that's how the laser lights are produced. Okay. So it can be used either in a contact or a non-contact mode. The laser tip directly contact with the tissue, especially for a cutting or an ablation procedure. We'll use the contact mode of laser. Whereas in case of a PBM therapy for stimulation, we'll use in a non-contact mode in order to reduce with the contamination and overheating of the tissues. So when you're moving with the distance in contact and non-contact mode, the laser beam, it's going to get either a widened or it's going to be a narrow pointed. So based on the condition or based on the clinical implication we need to apply with the laser, the emission modes it's going to get varied. And most importantly, how the laser it is going to interact with the tissues, and which interaction is most necessary in order to have a beneficial effect out of it. So reflection. So laser energy just bounce onto your tissue and back. Just bounce and back. So there is no beneficial. It is waste of energy and doesn't have any effect. Okay. Whereas in case of an absorption, the lasers will get absorbed by the tissues. How it is going to be absorbed by the tissue? By the specific absorption markers. We will call it as in terms called chromophores. They will absorb the laser light. For example, in eye, it is rhodopsin. Within the blood, it will be your hemoglobin. In the gingival tissues, it is an hemoglobin. With the teeth, you will have an hydroxyapatite. The water content, it all can act as a chromophore. When it is going to interact with that, it is going to produce within beneficial effect and the desired outcomes, clinical outcomes we can expect. Whereas in transmission, the laser energy will pass through the tissues but does not have any significant interaction or effect. So PBM, in case of a deeper penetration in skin, this transmission effect we can expect. Scattering, again, it is a non-beneficial one. It just spread in a multiple direction. It does not have any target or will not react with any of the tissues within the cells are present. So either the 90% absorption reaction, this is what it's going to be in really a beneficial one. In case of an PBM, some amount of transmission we can expect. It is the most effective and a beneficial mode in order to have a precise control with your laser clinical effect. So what kind of reaction you can expect? Absorption. This is what we need in order to have a cutting, ablation, coagulative, a stimulative effect depending on the chromophores on which wavelength we are going to use with it. And that's how the absorption ranges it's going to get varied. Okay, next we'll come to few of the key acronyms related to the laser. So the different types of laser are carbon dioxide laser, erbium doped yttrium aluminum garnet laser, erbium chromium doped yttrium scandium gallium garnet laser, neodymium holmium yttrium aluminum garnet laser, a diode, it is in semiconductor laser, and light emitting diode, it is based on the type of an lysodes, it will also come under one of it. Next, the technology related to it, laser, lace, PBM, LLT, HLLT, and TPO. It is something related to your curing agents present in the dental composites with the LED as in light source. With the clinical application, LANAP, laser assisted new attachment procedure, a peri-implant procedure called LAPIP, wavelength optimized periodontal therapy, laser activated irrigation, laser bacterial reduction, LAS, laser assisted soft tissue, either augmentation. If it is going to be R, it will be a regeneration. And most importantly, there are certain parameters set by American National Standard Institutes when we are working on the laser. It is a mandatory thing to wear with the goggles because the rhodopsin which is present in our eye, it is in one of the comfort which can interact with the lasers and its wavelength. So that is why the goggles is must. Always the patient should wear it first, and he should be the last one to remove it off. So there is a famous term, patient first on and last off. First on and last off. It is for the patient. And OD will be mentioned. That is the optical density will be measured and be mentioned in your goggles. As per the wavelength, it is going to get varied. So the allowing of the transmission of the light, with that the optimal density it is going to get varied in its function. So what is the role of a laser? To cut, to coagulate, to cauterize, and as you cut with the laser, it is going to be in sterilized incision rather than your scalpel. That is a major advantage. So next, what are the advantages? So it is a growing demand in this world fast era where we require a minimally invasive procedure and an instant procedure with a reduced discomfort, with improved patient efficiency, precision, and comfort. So laser will do justice to it. Aesthetic and functional outcomes, and most importantly, the recovery time, it is going to be very minimal if you're going to opt for the laser compared to the conventional techniques. Well, there's lot of advantages. You'll have few limitations also, right? Everyone can't be a god, right? Everyone can't be a pure. There will be certain disadvantages. If you know how to operate it rightly, these limitations can be avoided. It is not suitable for all oral procedure. We should accept that. It is not a super master, right? It is not suitable for every procedure. Improper laser choice and parameter, you can ablate more tissues. So you can expect the worst of worst if you're not going to use it rightly. Risk of burns, ice, and thermal damage. Charring, smell, the flush order. If you're going to give too much of it, keep on heating it with the laser, it might char and the flesh odor can come as you cut with the tissues. And some procedure, it can be time consuming. And in India, it is going to be definitely expensive. Not soon time, just like a CAD CAM, we are going to use laser on day-to-day protocol. Within every protocol, the laser, it can be an assistant for sure. So as Rossman and Cobb says, more precise, more visibility, laser sterilize as it cuts, less post-operative pain, less wound contraction, no scars, less damage, less need for suturing. Note down certain words, a minimal in suturing, less damage in suturing, less need for suturing, patient comfort and acceptance, it's going to be more, less patient post-operative complications, and it is going to be definitely advantageous for an immunocompromised and systemic patients. Thank you all. With this note, I complete the introduction to